At least 5 or more years ago, I started noticing a change in the end of my feet, kind of a little tingling feeling, and then as time went along it got to be more of that kind of feeling. And I noticed too that I began to, when I would first stand up, I would be off balance. So I did some self-evaluation on Google and realized that I was almost 100% sure I had neuropathy. At that particular time, I went ahead for my annual physical, and my blood work did not show up that I was diabetic. So then I knew I had peripheral neuropathy. So that was what really was my first feelings about knowing that I had a problem. I had mentioned that to my family doctor, and he had put me on one medication. I was already on medication for high blood pressure. And so I took that for a while, and I was really concerned about the side effects a lot, but I didn't notice any change. And then I just sort of let it go, and I started thinking maybe I'm just going to have to live with this. I'm just going to have to deal with this, you know, because it's probably not going to be any better. If anything, it'd probably get worse. I didn't know at that time that it might move to your knees or even to your wrist or hands. So I was, you know, obviously very concerned about it. I had seen your advertisement in the newspaper, and I had been praying about the situation. I'm a born-again Christian believer, and so obviously I was trying to come to grips with, is this what I should do? And I liked what I read in the article. I was very obese. I've had a problem with obesity throughout my life too. Been up and down the roller coaster of gaining and losing weight. And so I read too that sometimes diet can also affect, as well as medications can affect neuropathy. I guess the best way I could explain to you the way I feel now than the way 3 months ago when I started the program is to say that I feel 20 years younger at least. I'm much more alert. Also, I'm interested now in things that I used to be interested in as far as yard work. Or I live a very active life anyway. I'm very active in my church. I sing there in different groups, and those kind of things before had just begun to fall into the, you know, to the bottom. Now they're back up, and it's just, I'm just amazed is all I can tell you. People are noticing it. They're asking me, what has happened to you? And I just tell them about new life. I can stand up now without feeling I'm going to fall over, for one thing. My feet are so much better. I'm able to walk better. My main problem, I would see the advertisements on TV with the tingling and the twitching and the like insects and that thing. I really haven't had that sensation. Mine has been primarily numbness and balance. And I've just seen a remarkable change in that. I'm pretty sure that I was nearly 360. I weighed this morning, I thought we might be doing this, so I weighed this morning to be sure, and I'm 289.2.
That's amazing.
So that is really amazing. Now, let me mention this too. I've done this though, unfortunately, several times in my life. I've gone up and down, up and down. But I now know the difference is, what the difference is going to be, and that is I'm not going to be back into that lifestyle of, you know, eating nothing but carbohydrates and bread and that kind of thing. I've learned that I can actually exist and live without those things. But 3 months ago, my blood pressure was like averaging 159 over 98 to 100. I just recently had my blood pressure checked, and it was like 107 over 73. Marvelous. My pulse would be up near 100. It was like 59, 60. So that in itself was such a motivation for me the first time I took my blood pressure after being on this program, that it obviously kept me going. Another thing that I've learned from this that I think is vitally important for people who are thinking about coming on this program is the idea of not relying on medication. All of my life, and most of us have grown up thinking, I'm sick, I'm going to the doctor, he's going to give me some pills or medication. Now I'm thinking about how can I eat, how can I live my life, how can I exercise, whatever, to avoid taking medication. And I'm not off of my medications yet, but I think I'm surely headed that way, if not off, at least, reducing or whatever, and that's what I'm hoping will happen also. You and Carrie and Dr. Hirschhorn are just very professional. He gave me the true facts to begin with. He didn't hide anything under the bush or anything. He let me know exactly. He built this program for me, gave me my notebook, and I've been writing down my meals. I've been doing exactly what he asked me to do, almost 100%, and this is the result. I'm going to obviously refer a lot of folks that I know. I'll tell them about, I've already begun to do that, but tell them about this program. And it costs some money, obviously, but boy, is it well worth it for what I've seen in myself in the past in the change. It's just wonderful to feel the way I feel. It's almost as though I've literally regained my life.